Welcome to Path to Nursing. Test your knowledge with 10 original NCLEX Obstetrics questions. Pause the video, choose your answer, then listen to the rationale. Let's begin. Question 21. A nurse is reviewing a fetal heart rate tracing that shows early decelerations. Which nursing action is most appropriate? A. Notify the healthcare provider immediately. B. Continue to monitor the client. C. Administer oxygen. D. Stop the oxytocin infusion. Correct answer, B. Continue to monitor the client. Rationale: early decelerations are caused by fetal head compression during contractions and are generally considered a normal finding in labor. Question 22. A laboring client has a fetal heart rate baseline of 165 beats/min for 15 minutes. Which condition may contribute to this finding? A. Maternal fever. B. Umbilical cord compression. C. Fetal head compression. D. Maternal hypotension. Correct answer, A. Maternal fever. Rationale: maternal fever is a common cause of fetal tachycardia. Other causes include infection and certain medications. Question 23. Which fetal heart rate pattern requires the most immediate nursing intervention? A. Moderate variability. B. Accelerations. C. Recurrent late decelerations. D. Early decelerations. Correct answer, C. Recurrent late decelerations. Rationale: recurrent late decelerations may indicate uteroplacental insufficiency and fetal hypoxia, requiring prompt intervention. Question 24. The nurse observes recurrent variable decelerations during labor. What is the nurse's priority assessment? A. Assess for possible umbilical cord compression. B. Assess maternal glucose levels. C. Encourage oral fluids. D. Prepare for discharge. Correct answer, A. Assess for possible umbilical cord compression. Rationale: variable decelerations are most commonly associated with umbilical cord compression. Question 25. Which finding is considered the most reassuring during fetal monitoring? A. Baseline heart rate of 145 beats/min with moderate variability. B. Persistent fetal bradycardia. C. Recurrent late decelerations. D. Absent variability. Correct answer, A. Baseline heart rate of 145 beats/min with moderate variability. Rationale: a normal baseline with moderate variability indicates good fetal oxygenation. Question 26. A nurse is caring for a laboring client receiving oxytocin. Late decelerations begin to appear on the fetal monitor. Which nursing action is appropriate? A. Stop the oxytocin infusion. B. Increase the oxytocin infusion. C. Encourage the client to ambulate. D. Continue the infusion without changes. Correct answer, A. Stop the oxytocin infusion. Rationale: oxytocin should be discontinued if recurrent late decelerations occur because excessive uterine activity can reduce fetal oxygenation. Question 27. Which fetal heart rate characteristic is associated with adequate fetal oxygenation? A. Moderate variability. B. Persistent late decelerations. C. Prolonged bradycardia. D. Absent variability. Correct answer, A. Moderate variability. Rationale: moderate variability reflects a healthy autonomic nervous system and adequate oxygenation. Question 28. A nurse notes a prolonged fetal heart rate deceleration lasting 3 minutes. What is the priority nursing action? A. Reposition the client to the left lateral position. B. Continue routine observation. C. Encourage pushing. D. Prepare for discharge. Correct answer, A. Reposition the client to the left lateral position. Rationale: prolonged decelerations require immediate nursing interventions to improve fetal oxygenation. Question 29. The nurse recognizes that accelerations are best described as A. A reassuring sign of fetal well-being. B. A sign of fetal hypoxia. C. Evidence of placental insufficiency. D. An indication of umbilical cord prolapse. Correct answer, A. A reassuring sign of fetal well-being. Rationale: accelerations are associated with adequate fetal oxygenation and an intact nervous system. Question 30, bonus SATA. A nurse is caring for a client with recurrent late decelerations. Which nursing interventions are appropriate? Select all that apply. A. Reposition the client to the left lateral position. B. Stop the oxytocin infusion if it is running. C. Increase the primary 4 fluids as prescribed. D. Place the client in the supine position. E. Notify the healthcare provider if the pattern continues. Correct answers, A, B, C, E. Rationale: A. Left lateral positioning improves uteroplacental blood flow. B. Stopping oxytocin reduces uterine stimulation and may improve fetal oxygenation. C. Increasing 4 fluids can help improve maternal circulation and placental perfusion when appropriate. D. The supine position can decrease blood flow to the uterus and fetus. E. Persistent late decelerations require prompt evaluation by the healthcare provider. On the notification bell so you never miss a new NCLEX practice session.